I was supposed to follow that amazing panel that Sammy led, and I thought that was going to be really impossible. So I made Leslie do that instead. But now I have to follow Leslie, so I guess it didn't turn out all that great for the order of events anyway. I'm Francis Collins. I'm currently a senior investigator in the Genome Institute at NIH, but I'm also undergoing a detail to the White House, so I have to disclose that I'm also the Special Projects Advisor to the President of the United States. But not right now. Right now I'm here because I care deeply, as you all do, about this disorder called progeria, more precisely Hutchinson-Gilford progeria syndrome, which has been an activity my lab has been engaged in now for more than 20 years. And the progress, as you have heard, and you saw that curve just now about the way publications are going like this. And they're not just academic publications that don't mean anything, they're publications that are leading us progressively towards advances. And it was just absolutely inspiring, Sammy, to have you lead our panel, because we haven't had the chance to do that before at one of these meetings. And if you wanted to be reminded why we're all here, that was the reason. So what a great way to kick off our time here together. I think, is Maria Erickson here? Has she arrived yet? Yes. Somewhere here. Ah, there. Maria, I think it was just about exactly 20 years ago, on a Saturday, working in my lab, trying to find the cause of progeria, that you called up and said, I've got this funny finding in the sequencing of this gene on chromosome 1, but it doesn't make a lot of sense because it looks like a lot of the kids with progeria, and we got those cells from Leslie and the foundation, a lot of them have the very same change in the sequence. It's a C that's mutated to a T, and that seems really significant. But then when I went and looked at the genetic code to try to see, well, what would that do to the protein? It doesn't look like it would have an effect. It looks like a silent mutation. It goes from GCC to GCT. That's still glycine. So, that must not be it. I was like, well, wait a minute. It only took a couple hours, I think, staring at the sequence to realize, oh, it's maybe silent at the protein level, but it's not silent in terms of its effect on splicing. And Leslie showed you that picture, and then we figured out, oh, that's it. This is creating a protein that's missing 50 amino acids. And as Leslie said, we were fortunate that we landed in the middle of an area of really beautiful biochemistry and cell biology of people who had worked on this lamin A gene for years and never knowing that it would turn out to be so relevant all of a sudden to try to understand why this single letter change would cause this condition called progeria. And my goodness, then we all got to know each other really well. And the foundation made that possible with all the gatherings that were supported. And along the way, we understood rather quickly what the consequence was in terms of what this did to the health of a cell and to the nucleus of that cell and its shape, and you saw a picture of that. And it is rather amazing because that led within, I would say, weeks to the idea of a farnesyltransferase inhibitor as a possible therapeutic. And that timeline went by pretty quickly, but it was 4 years from gene discovery to starting a trial. That's almost unheard of for any disease, and certainly for a rare disease. And that just is an indication of how many people put their hearts and minds into trying to figure out how to quickly take that basic science discovery and move it forward. And that's what PRF has always been all about. Fund the basic science, figure out some of these really critical issues about how this particular protein does what it does. But don't stop there. Figure out how to turn that into some really interesting ideas about treatment. And now here we are at a very interesting place. And this whole meeting is just shot through with all kinds of cutting-edge research that has consequences for our understanding, and even, as you'll hear tomorrow morning in this session that I get to be the moderator, perhaps impending opportunities for clinical trials based on totally different approaches than a farnesyltransferase inhibitor, but they'd be very complementary, maybe using RNA, maybe gene editing to actually go and fix that T that should have been a C, using a gene editor. And you'll hear an amazing presentation tomorrow morning from David Liu, who is the guru of all of this. David Liu could work on almost any disease if he decided he wanted to. He is completely immersed in progeria because of his commitment to why this is so important. So it's pretty amazing to be here. And I too kind of am really glad to be together face to face after so many Zoom calls. I do apologize, I've got a cold, so I'm not gonna hug anybody, and it's really killing me not to, because I don't want to give you whatever I've got. It's not COVID. I want to reassure you, I am antigen negative and RNA PCR negative. I do not have that one. It's just a cold. You know, we can still have those things, I guess. We kind of forgot about that. But anyway, it's an inspiring time, and I guess 4 years ago, somewhat in an impromptu way, we ended up having a little singing as part of this, and Leslie, never missing a beat, decided, well, we should do that again. And I seem to have been asked to be the one to help you with that by perhaps leading a little bit of this. And again, because of this cold, I might sound a bit more like Rod Stewart today, as opposed to James Taylor. But sort of trying to figure out what to sing at a time like this. Well, it seemed like we are all gathered here because we care deeply about this condition, which needs a lot of attention and a lot of advances. And as brave and bold as our Progeria panel represented their situation, they need us all as friends, and we are friends. This is what PRF is all about, and we need to keep that forward and remember that we are there in whatever way we can be as scientists, as physicians, as just people who care. So maybe a song like You've Got a Friend doesn't seem totally out of place. And if you know the chorus, and I think a lot of people do, I hope you'll join in with me. When you're down and troubled, and you need some love and care, and nothing is going right. Have you had days like that? Close your eyes and think of me, and soon I will be there to brighten up even your darkest night. You just call out my name, and you know wherever I am, I'll come running, see you again. Winter, spring, summer, fall, all you gotta do is call, and I'll be there, yeah, yeah, yeah. You got a friend. If the sky above you should grow dark and full of clouds, and that old north wind should begin to blow, keep your head together and call my name out low. Soon I'll come knocking upon your door. Come on, y'all. And you just call out my name, and you know where I am. I'll come People can be so cold. They'll hurt you and desert you. They'll take your soul if you let them. Ah, now, but don't you let them. You just call out my name, and you know wherever I am, I'll come running to see you again. Winter, spring, summer, or fall, all you gotta do is call, and I'll be there, yeah, yeah, yeah. You got a friend. You got a friend. You got a friend. Woo!